Hey guys, I'm Dr. Ruth Roberts, the creator of the original Crock-Pot diet, and I've got a couple of questions for you to answer for you today. And excuse me, I'm going to just turn this off because, yeah, that's better, isn't it? That was pretty gnarly lighting. At any rate, I want you to enjoy the answers hopefully today, and hopefully they're of help to you as well for your pups. But right after this broadcast, I'll be doing another Facebook Live broadcast with Barney Kunze, who's organized the Animal Wellness Summit, which is a totally free 10-day online wellness summit that gives you perspective and information from many different veterinarians as far as different options for feeding, different modalities for healing, things of that nature, people that are involved with essential oils, and also people that work in training, particularly dogs, horses, birds, and no cat trainers, unfortunately. Maybe that's going to be my next career move. But at any rate, this is going to be awesome. The fantastic thing is, again, it is completely free. I'll have a link in the comments below to get you over to the sign-up area. And I think you will enjoy it. It's a great way to get some alternative information very inexpensively. Your only investment is time. So stick around for that. Our first question comes in from, and I guess I'm the kidney expert, but it's just heartbreaking to me, the stuff that people get told from their veterinarians, and sometimes it's right and sometimes it's not. And of course, that's my opinion too. But at any rate, a lady wrote in and was asking about her Shih Tzu who picked up a gastroenteritis bug from their other dog during a beach or a walking holiday. And was sick and had diarrhea, and then unfortunately developed into kidney failure. And so they got care for the puppy and for the older dog, and unfortunately the kidney values are still up even after several days of intravenous fluids. And it's disheartening, because when the creatinine values don't budge after intravenous fluids, it's not a good omen, so to speak. And her veterinarian has been kind and sort of set her expectations appropriately as to what might happen. And their game plan is to go with about 3 days of IV fluids, see where things get to, and then kind of take it from there. Her question is, what to do afterwards. At what creatinine level would it be sufficient for us to deliver home care and adopt the kidney program? And she's also wondering about home-based fluid therapy. So I'm so sorry you guys are going through this, and I hope that something else pops up. It is worth asking if your veterinarian has tested for pyelonephritis or kidney infection, because if all of this kind of started after a GI bug, that may be going on. The other thing is leptospirosis, which is a bacterial infection, and it can start out with GI symptoms and then progress to what appears to be kidney disease, but truly is this bacterial infection creating havoc in the kidneys. It can also end up creating havoc in the liver. So I would definitely speak with your veterinarian about that. The upside is that the vast majority of the time, leptospirosis responds to very simple antibiotics such as amoxicillin. So I would double check that those two issues are off the table, because if they're not addressed, then that kidney disease is going to worsen as this bacterial infection, whether it is leptospirosis or a different bacteria, kind of continues to play havoc. So having said that, we get hung up on the numbers, and the lady mentions that her pup's creatinine is currently at about 7, which is quite high, and that's certainly in stage 4 iris disease, which is kind of considered to be end-stage kidney disease. So the thing is that there's the number. So here's the number on a piece of paper, and then here's what the dog is doing. And the numbers are difficult. So For a patient that's had an acute bout of kidney disease, 7 is really high and scary. For a dog that's had chronic kidney disease, and perhaps it was unmasked with this outbreak of diarrhea, not so scary. And it may be that she's been at that level for some time and has been dealing with it on her own, and then, all of a sudden with this acute episode of diarrhea, it's made things kick into high gear. And it's also possible with the diarrhea that insulted her kidneys via chronic dehydration. So where I'm trying to go with that is it's not so much where the number is as to how your dog feels. If after 3 days of IV fluids, your pup is still very lethargic, not eating, not feeling good, that's not so great. And that makes anybody's job difficult to do as far as trying to offer this poor pup some help. But if after 3 days of fluids, maybe the numbers are not budging as much as we like, but your dog is feeling well, it's eating well, it's starting to regain some of its energy and personality, then that bodes a whole lot better. So at home, what can you do? And one of the big things when the values are still that high is subcutaneous fluid. So it's like the poor man's dialysis. This is the way I always explained it to my clients in the past. And what that means is that you are able to kind of continue to flush the kidneys out. Maybe it's not on a daily basis, maybe it is, maybe it's every other day, simply by giving fluids under the skin. It is not as effective as intravenous fluids, but it is on, it will definitely help. And so that is certainly one thing I would look into. The best place to get information about that is from your veterinarian, because there are some dogs and cats that are amenable to that idea and others that think it's genuinely a bad idea. So you're going to have to just play with what your dog is finding acceptable and what makes sense for everybody. So sub-Q fluids are great if they're well accepted. If they're not, then the other option is to try to get in as much fluid as is possible orally. And one way to do that, particularly for a dog that's had GI issues and now kidney issues on top of that, is to make like a congee. So in traditional Chinese veterinary medicine, if you'd been really ill for quite some time, this was one of the first things you were offered as food to help sort of reintroduce your gut to digestion and also to give your gut something that's easy to work with. And literally what a congee is essentially a rice porridge. So instead of making 2 cups of water to a cup of rice to make a pot of rice, you might use 4 cups of water to that cup of rice. And you can also include things like bone broth, proteins that are very, very easy to digest already, cutting them into small pieces, letting them really cook down thoroughly so that they're very, very soft and easy to chew, and more importantly, they will be easier to digest as well. And, and at that first meal, that may be all that's in there is maybe some bone broth, chicken, or pork or beef or whatever your dog or cat does well with, and then that rice congee. So that's a big step. The other big thing is that phosphorus level. So we get hung up talking about BUN and creatinine and following those numbers, and it is important to do that. But phosphorus level is often a much better reflection of how well your dog does or doesn't feel, and also how good the GI tract is going to respond to things. The higher the phosphorus level, this is where we start to see animals vomiting, having diarrhea, things of that nature. So it's extremely important to get some sort of a phosphate binder on board. And the simplest one to use is aluminum hydroxide. Silevimar is a prescription drug from the human side, which has been used for dogs its big plus is that it's a tablet once every 24 hours versus aluminum hydroxide is something you have to add to the food. So for dogs that are nauseous, not eating well already, Solevamar can be a great option simply because it takes that phosphorus level down without having to depend on your dog eating. And also, if they're already nauseous, often adding drugs into the food makes them not want to eat it. So drugs or supplements for that matter. So once you get those two things down, dog's feeling decent and is eating reasonably well, then that's when I would begin to add in supplements and other options as far as food and things of that nature. So I hope that makes sense, but the big thing, it's not so much where the number is, it's truly where is your pet? How does your dog feel? How does your cat feel? And then that determines what your next step is. Hope that makes sense. I saw a question pop up here from Barbara, and she said her dog's only 4 and has had no health issues, but she wanted to try her on a veggie diet. She ground up the veggies and added a raw egg, and then she refused. And then unfortunately, it doesn't give me a lot of space to look at. So my guess is that you're making an abrupt change in diet, and there is a big push out there that raw food is the best way to eat. Well, I can't necessarily get behind that. I think for some animals it's the truth, but for many animals and certainly for many people, if your digestion is not spot on, raw food's pretty intense. And then the other concern too is that with a raw egg, particularly if that's from a conventional source, your risk of salmonella is quite high. Even with pasture-raised eggs, it's from a good farmer, it's less of an issue, but we're starting to see families that have backyard chickens that are unfortunately having their whole family start to get infected with salmonella because they're not, they're going outside and hanging out with the chickens and picking up eggs and stuff and then not washing hands carefully afterwards. So just be mindful of that. The other thing is with a vegetarian diet, I just don't see dogs do very well with that. There are several vegetarian type diets available, and for dogs that have horrible GI issues or skin issues that are related to food sensitivities, sometimes we need those to get things under control. But the vast majority of dogs that I see that stay on vegetarian or vegan diets for long periods of time end up developing liver enzyme elevations. And what that tells me is that they are not getting the nutrients they need in order to live well. So granted, there may be moderate to low protein levels, but particularly with raw diets, they may not be able to actually absorb and digest those proteins. And so that's why I still do recommend strongly going with a meat-based diet for dogs. But we do mix in, again, so the original Crock-Pot diet, the goal is to offer roughly 30% meat protein, 30% vegetable by volume, and then 30% fat as far as calories goes. So those macros are good as far as helping to keep things on the even keel. And in fact, in my research, that's what I found probably were the ratios that we ate in for thousands and thousands of years. And we've tried to change those very rapidly. The high carb diet's not working out so well. More simple carbs taken out of the diet, the better as far as reducing inflammation. The more complex carbs, which are things like vegetables and beans that are higher in fiber, the better, because that aids in digestion. It prevents a massive sugar rush into the bloodstream. And then you have appropriate levels of fats and protein to fuel the body healthily. So Barbara, I hope that answers the question for you. The one other thing I'll add to that too is that if your dog was eating kibble today and you offer this mashed up veggie stuff tomorrow, that sometimes you need to transition slowly. So literally you may start with 3/4 of what your pup was accustomed to eating, and then add in 25% of what you're trying to switch your dog to. The other issue is making sure that that stays nutritionally adequate. And I'm trying to get away from saying complete and balanced, because that isn't actually necessarily the case once a food has been approved by AAFCO. So, but what is important is to make sure that there is adequate nutrition available for your dog to digest. So hope that helps. The other thing I wanted to talk with you about today is Lori wrote in, and she's got several dogs. One dog has stage 2 kidney disease. Another dog has significant arthritis and cancer. And so she asks, her dog with kidney disease has a creatinine of about 2, and she's saying, from what I'm reading, then probably I don't need to adjust the protein. And I would say that is absolutely correct. I do not want to adjust the protein down with kidney disease until we're at levels where we simply cannot keep that phosphorus level up there. Keep the phosphorus level under control, because that's what's going to create more of the malaise and feeling cruddy from kidney disease. So, and then as far as the dog with cancer, she's reading that she shouldn't have rice, potatoes, and kidney beans. So basically, and Sally's telling me there's video feed issues, and I'm not sure why, but there you go. That's the miracle of technology. Hopefully it comes back. At any rate, so for dogs with cancer, to not feed simple carbohydrates. And yes, that's coming out to be more and more true with research both in the veterinary side and the human side. So her question is, what does she do with these 2 dogs? How can she make one batch of food but feed both dogs? And Lori, there's a couple of things that we're getting underway. And again, my apologies. My goal had been to get some recipes up into the original Crock Pet Diet members area that are going to address the ability about how to multi-pet cook, if you will. So there'll be keto versions for dogs with cancer, and then versions that you can use for dogs that are healthy. And so in this situation, what I would do is pick either a keto version or a version of the Crock Pet Diet that is very low carb, and make that as a big batch, and then make a pot of rice or potatoes or whatever the carbohydrate is that you're going to use for the other dog, and add that in. And so the way you would feed that is, for the dog with cancer that needs the keto diet, you'd feed whatever volume it is that that dog needs calorically to stay healthy, fit, and at a good body weight. And then for the dog that does not have cancer, then you would figure out roughly kind of how many calories per day that dog would need, and relate that back to a volume of food. And then 2/3 of that is going to be scooped out of the batch of food, and then 1/3 of that volume will be scooped out of the rice. So for instance, if your dog weighs about 50 pounds and it's fairly moderately active, and it needs a cup of food twice a day, so that's something like 250 calories per cup to 300 calories depending on the recipe, then what you would do is give 2/3 cup from the keto batch and 1/3 cup of whatever your starch is, and that's going to make up the diet. So I hope that makes sense, and will keep things relatively simple and a lot less work input. And then Anjita asks about her Chihuahua who's got seizures every 6 months, and it scares her, and it is very frightening. So it is horrifying when we see a dog with seizures, and I had a dog with seizures, and it was just awful, and I knew what was going on. So the thing is that we try not to give any seizure medication until things are getting more severe, like once a month type seizures or clusters of seizures. So what can you do in the short term to help prevent those seizures from being more frequent? And one thing, interestingly, is keto diet. So that's a high fat, moderate protein, extremely low carbohydrate diet. That's been shown to reduce the seizure focus in children, and in many children that have idiopathic epilepsy, they were able to reduce the seizure severity and frequency enough to be able to come off of medication and have very rare, or in some cases, no seizures whatsoever. And in many cases, the diet helped them to reduce the amount of medication they needed to keep the seizures under control. The next thing you can do is to, if you've got an idea that a seizure is coming, and some dogs do have a very pronounced seizure aura, so you might notice them getting really clingy or pacing or something of that nature. That's where using something like Valium, which can be given both orally if you have enough sort of heads up that aura is happening and a seizure is coming. And the time you would need to make that effective to help prevent the seizure is something on the order of 30 to 45 minutes for it to be absorbed and get into the system. The other option is Valium injection, and again, this is a controlled substance, and this is something you will need to work with your veterinarian on. The other way Valium can be used is actually as a nasal spray. So for many years we gave it as a sort of an installation in the rectum via a feeding tube, because it's very, very quickly absorbed there, actually as quickly as intravenously. But more frequently now you can give it intranasal. So you would have some liquid injectable Valium in a syringe and literally would spray it in the dog's nostril. So, the sinuses have a tremendous blood flow, and so it can be absorbed very quickly that way. So that's an option. The other thing you want to work on too is, again, sort of reducing inflammation, the whole deal. Remember, in the gut, the good guys, when they're in control, produce 90% of our neurotransmitters. So you want to make sure that your pup's gut health is excellent. And certainly feeding crock-pot diet, feeding a good quality anti-inflammatory diet is imperative. And then using things like probiotics and fish oil, again, to reduce inflammation and to help the good guys gain a foothold so that they are supporting your dog's neurological transmitters and hopefully helping to make the neurotransmitters that will calm that seizure focus down. So I hope that makes sense. Do you guys have any other questions for me today? Let me just make sure we haven't missed anything. And Sally, great to see you as always. Always appreciate you tuning in. Again, stay tuned. I'm going to come off of this live broadcast and get on another one with Barney Kunze, who's organized the Animal Wellness Summit. But again, this is an excellent opportunity for you guys to get different perspective from folks in the animal healthcare field, be it veterinarians, trainers, people that work with essential oils, do massage therapy, various and asunder different techniques to help improve your pet's health. So check that out. I'll have a link where you can just click on the link and go register for the summit. It runs from November 10th until the 20th. And the broadcasts are completely free during that time. And if you find that information is of great value, then there is a way to purchase access for the year, which I think is going to be really cool as well. So that's what I know for this week. I hope y'all are well. And it's finally fall in Charleston. It's a gloomy gray day, but it's all good. So until next week, remember, your pet's best health starts in the bowl. Oh, and I'll be having a presentation on that summit, so check it out. Take good care.